there's a whole world full of abuse in the healthcare system because it's a third party payer and because it's coded that way and because they've sort of forced the surgeons to be rewarded for more surgery, not better quality surgery. So
I I really hope the pendulum does start to swing back. Like it's gone so extreme, and I think this is hopefully this gets heard by other people and people build the confidence. Either they're doing it already and they get that reassurance, or they're making some decisions to make some adjustments. Because when I started in this industry, it was like, yeah, this is the way it's going. These re- residents do not get educated on the business side of things. If you ever want to get residents to an event, it's no longer beers and fries.
Yeah.
It's like, hey, I have somebody coming in. They're going to educate you on the business side.
Yeah.
Every single resident in the whole
They'll be there.
area will be there because we know we're learning how to do surgery. We don't know how to run a practice or anything like that. And I'm accruing debt. So let me just join a practice that's going to help with that, or a guaranteed money from a hospital, and it'll be covered. And that has kind of balled itself into where we're at today, where surgeons are just another employed person who don't have a say, and sales reps have had to deal with that, right? Like we got to sell the doctor, but they don't really get to tell anybody what to do anymore. But they're the ones who have to make sure that they like it, and then you got to go to the hospital and all these other things. But hopefully it swings back to where you are now operating. It kind of I've so overlooked this. Insurance will pay you not based on your experience level or your great outcomes. You'll get penalized if your outcomes are bad. And another way to get paid more is to make sure that you're trying to bill for everything. So you're making decisions thinking about what line item can I bill for, rather than just doing the damn surgery for the patient and what's right for them, which is where you're at. So
yeah, I mean, you again, very insightful, right? Like not being in the middle of this, like you're whether it's conscious or unconscious, right? Like you'll do a case and you'll say, oh yeah, in the back of your mind, that this part of the surgery is bundled with something else that you're doing, right? And so whether or not you mean to, you're going to kind of go through that part of the case with a little less, thought or not as meticulous because you're, in your mind, you're like, I'm getting paid nothing for this part of the surgery. And what's great about, being, you know, billing the patient is that you don't have to divide it up amongst this arbitrary coding system that they've set up, right? A shoulder case, for example, you'll typically bill, you know, 4 codes, 3 or 4 codes for each of the different parts of the surgery that you do for the cuff repair. If you work with the biceps, if you do a decompression of the subacromial space, like those are all different codes. And so people used to try to maximize their reimbursement by doing billing more of those codes. And the insurance company said, we don't think all of these codes are indicated. You're just trying to overbill us. And so we're going to fight back by bundling some of these codes together, right? So that even if you bill 1 code for a rotator cuff repair and you do a bone spur removal, that's now going to be included and bundled together. So they tried to stop that process. And the beauty of doing this, this sort of self-pay is that you decide, right? Like you're going to tell the patient, look, I'm going to fix your shoulder and this is what it's going to cost, right? Like there's no, dividing it up. Now, unfortunately, the facility still sends that bill into the insurance company. And so you still do have to code and you still do have to parse it out on what you did. But from your perspective and your reimbursement, it's a shoulder arthroscopy and it costs this, right? And so you're a lot more free, I think, to your point, to just do the best job you can and not think about what's getting paid and what's not getting paid. And there are tons of horror stories out there, in the shoulder world about, medical device reps, for example, being in a case and seeing a shoulder that looks completely normal and having a doctor sort of shave a tear into the rotator cuff and then repair it, right? Like, so you can bill a rotator cuff repair, you know, and there I've seen those cases, right? I've been an expert witness for those cases. I've seen video where you look through, you know, the arthroscope, that this thing that the surgeon sees, and you're like, yeah, that's not torn. And now they take a shaver or they take a rasp or something and they undermine the tissue, and now it looks like a tear. You know, like there's a whole world full of abuse in the healthcare system because it's a third party payer and because it's coded that way and because they've sort of forced the surgeons to be rewarded for more surgery, you know,
Yeah.
not better quality surgery, right? If that makes sense, you know?
There's incentive for that.
Yeah, it's pretty bad.
Yeah.
Um,
It's
and
like
and again, back to the whole medical device thing, like that's an interesting ethical thing that might come across your plate when you're standing in there watching that case. Like, you might be a surgeon that has said, "Hey, this patient has a rotator cuff repair. I'm going to need 3 of your anchors." And you're standing there and you look in there and you've seen enough and you've experienced enough and you're like, "Yeah, there's no cuff tear here." Well, that sucks for you because there's zero revenue for you. Like, if he doesn't repair that,
hmm
um, you know, you're not going to get paid anything for covering that case, and you're not going to meet your quota. And there's sort of an ethical kind of problem with all of that, you know.
Yeah.
And then what's even worse is if you see the surgeon then sort of do something that's unethical as well, right? Like, there's always those sort of horrible things that happen, um, that you need to be prepared to deal with when you're about to become, you know, a participant in the operating room, you know. So, but yeah, it's definitely freeing. I mean, I think you're talking about the pendulum too, swinging back, and Matt's kind of doing some future predicting on where physicians are going to fall. I think it's up in the air. I think AI is going to change a lot of this.
Oh yeah.
I think we could have an entire like 2 hour podcast on, you know, what the right way to ensure everybody in this country is, right? I mean, we could have long discussions on the, you know, is it true that healthcare is a right for every citizen? Because if that's the mission statement, then what you end up with is this behemoth, inefficient, terrible healthcare system that we have. I do think it's true that healthcare is probably a right for all of our citizens, but what it is now is a very base and bad level of healthcare is your right as a citizen of this country. And if you want good healthcare, you better be able to pay for it, you know. And that's where we're going, right? Like, people can get Walmart healthcare, but if you want somebody good to do your surgeon or to do your surgery, or if you just want, you know, sort of your baseline level of care, then you're probably going to have to pay on top of your insurance premium and on top of your deductible and on top of the other ways that the insurance companies are screwing you to
Yeah.
get good care, you know. And if you're in an ambulance, you're not really thinking about that, you know.
Yeah. That's right.
So, but you can have a whole like, I'd love to be in a super cool discussion about how to fix this system because um,
We can meet
it
again
is,
and have a deeper discussion into this. I know people would want to hear it.
yeah,
100%.
it's super fun. But yeah, I think you're right. I think the pendulum is swinging back. I think you're going to see like things like longevity clinics are going to start popping up, and they're going to be the internal medicine docs that are like, look, your insurance doesn't cover cutting edge stuff anymore. And so if you want to live to be 100, then we're going to, you know, we're going to test methylated DNA, right? We're going to get you a full body MRI scan. We're going to do a DEXA scan on you to see what your lean body mass is, you know, and your bone density is. And that's all going to be stuff that you have to pay for out of pocket because your insurance plan doesn't pay anything for that stuff.
Yeah.
And so that's how it's going to swing. It's not necessarily concierge medicine as it is just you get the bare bones crappy stuff, which is you go to your doc for a physical and he says, "Look, you're 50, you need a colonoscopy. You know, thanks for coming. I got to go see my next patient." Right? Like that's it. That's what it's good.
You
You
got
know?
to come out of pocket for your colonoscopy. Is that what you're
Yeah,
saying?
yeah.
Yeah.
No, I'm saying that's what you get at a baseline, right? Like if you have a primary care
Sure.
doc right now, and let's say you're a Medicare patient or whatever, you're supposed to get your yearly physical, but you're just going to get what insurance pays for. Now, insurance will pay for your colonoscopy, right?
Yeah.
Minus your deductible, whatever that is.
So you're still paying
Um,
for it. I mean, let's be honest, you're still paying for it because you got to have pay the deductible. So you're yeah.
yep. I mean, your deductible, for commercial payers is somewhere between 2 and 5 grand these days, right? And then there's co-insurance, which is probably around 15 to 20% if you've got a good insurance plan. So your colonoscopy will probably run you between, $6,000 and $10,000 all in, and so you're paying $2,000 to $5,000 of your initial deductible, and then on top of that, you're paying 20% of the remainder, which is probably another $1,200 to $1,500. So out of the $8,000 bill, you're paying about $5,500 of that out of pocket, and you have insurance.
Yep.
Right.
So why not just say, hey doc, you're gonna I know it costs like you're gonna get reimbursed. Whatever, I don't know what it is for colonoscopy, but let's say, hey, I'll pay you $2,500 cash, doc, instead of me having to meet a $5,500 deductible or whatever, and actually get my colonoscopy done and pay you cash versus.
Yep.
Oh, I also,
Yep.
by the way, I did pay a premium. Like I pay a monthly premium to have health insurance.
Right.
Top of
Right.
that
Right.
for the year, which is probably when you add it all up, is probably somewhere between $15,000 to $30,000. So my colonoscopy, because I got that one procedure this year, cost me
Yep.
20 grand. Thanks.
Yep.
Right.
Yeah.
Yep. And you touch on a good point, right? I've done a lot of research on this whole self-pay thing, right? And just an MRI is a great example, right? Like MRIs are super common. There are radiology companies all over the place that give people MRIs on a daily basis. And so what's interesting is that if you go to the MRI place and they'll say, "Do you have insurance?" I say, "Yeah, I have insurance," and they give you their insurance card, and they'll say, "Okay, your MRI today is $1,500 or whatever." And you're like, "Okay, well, my deductible is $2,000," and so they'll say, "Well, so how would you like to pay that $1,500? Can we take your credit card?" And you're like, "Yeah, okay." So you give them your credit card, and you just paid $1,500 on out of the out of your $2,000 deductible. So you had to pay that. Interestingly, if you walk up to the same counter and you say, "You know what? I don't have insurance. I'm self-pay, and I need the same MRI," and you say, "How much is the self-pay rate for that MRI?" It's $800, right? How would you like to pay? Give them your same credit card, and you pay $800 for that MRI because the amount that gets billed to the insurance is much higher than self-pay rates, right? Yeah. So if you don't plan on using your deductible to the max, it's cheaper to be self-pay for most of the things in medicine, right?
Yes.
It's crazy. It's a crazy,
And I
crazy broken.
think I forget at the moment, but I think people at the office are incentivized in a certain way, not a dubious way, but to find out before giving the price as to whether or not they have insurance or not, um,
Yeah.
so that that determination can be made as to what price to give, right? And that's incentivized from insurance, not by the people in the office. It's not that the person sitting in front of you wants you to pay more. They're indifferent. They're getting paid hourly.
Right.
But the insurance company has it set up in such a way, which is pretty incredible. And I know a number of people who have, let's say, left the corporate world and then they have to go get insurance on their own, and they're like, "Oh, I thought it was gonna be way more. I thought I've been saving a whole bunch of money with my employer plan because
Right.
it's a plan. It's tens of thousands of people in that company. You think you
Right.
get a nice discount. I just went and got
Yeah.
my own by myself. It's the same thing.
Yeah.
What's going on here?" So
Yep.
these golden handcuffs, as they call them, or these incentives, which it's nice to not have to deal with it and just pay and whatever. You get a good plan, but it's not what you think.
It's a total scam. It's a total scam for sure.
Incredible.
Yeah. And then that same insurance company comes back and goes, "Oh, by the way, you have a necessary surgery, and your surgeon requests to do that surgery, but we're going to deny it."
Right.
That's the fun part. Yeah.
Yep. Or again, they deny it afterwards, and then you owe $67 a year and a half later.
Yeah. Well, I obviously I hope this all changes, and I'm really curious to speak to you more about hearing about your essential predictions of how things are going to move forward. You gave us some insight on
Yeah.
it. But to think about all of, and speaking with Bree is up on so much of the latest, whether they be trends or they're proven, just like health and wellness measures, preventive measures, actions you can take so that you're healthy, or tests that you can take to ensure that you're okay, or maybe predictions for the future, whether it's genetic testing or a fecal exam for your gut,
Hmm.
all these different things. It's like when I get into that world, I don't even think about my insurance. And like
Yeah.
you said, insurance is essentially has become or will become bare minimum, right?
Right.
You broke your elbow, we're gonna fix your elbow. But like it's like, or is there anything that I could have done to prevent this? That's all
Right.
on you. Insurance is not looking into the different alternatives so that you can have preventive measures from not getting diabetes or whatever it is. Um, so you are getting, congratulations, you're paying a premium for Walmart, um,
Right.
and
Right.
I guess peace of mind. But in reality, if you really want good care, it's on you. So
Yeah, and I do think from a physician perspective, like there's probably an opportunity there, right? Like there's an opportunity to come out and say, this healthcare system is not built to prevent disease, right? Like we are not built to pay for or prevent diabetes, right? What we want is we want a pill to take after we have diabetes, right? We're not built to prevent obesity. We want a pill to take that keeps us from being obese, right?
yeah,
We're not, we don't have any insurance reimbursement for preventing arthritis. We're just going to pay for that knee replacement that you have once your arthritis is so bad that you can't walk. Like the whole system is not designed to pay for preventative type care.
right.
But that's a much cheaper way to go, right? And it's a much healthier way to go.
Yeah,
And so there is an opportunity, and I do think Matt's probably right, where there's going to be concierge doctors, and that pendulum is going to swing back, and there's going to say, here's our suite of products that we provide for you, and whether it's testing hormone levels, right, and doing hormone replacement, whether it's testing bone density, when you turn 40, because you're probably going to get osteoporosis when you're 80, but we're testing your bone density now when you're 40, and we're going to do things to prevent that so that it never happens, right? You end up dying before you get osteoporosis. Like there's nothing like that, you know.
right.
And people who have the means would be smart to find a provider or a clinic to start that stuff now, you know.
Yes.
And it's all nutrition and exercise, and everybody goes back to that. But there's a way to nuance that and target that, right? It can't be that everything is solved with good nutrition and exercise. You know,
Yeah.
there's other ways to screen for cancer and do other preventative things,
Right.
that should be directed by a physician. You know,
Correct.
and that's a hard thing to do if you've got 90 people to see in a clinic. You know, and if insurance won't pay for anything.
Yeah. Because it's to your point, it's mainly acute care, right? Come in. I just been shot with a gun in my arm. Please fix me.
Yeah.
I just got into a car accident. Please fix me.
Or it's managed,
Nutrition.
like if you think about primary care, right? It's managing it. Like, okay, I'm going to see you in 6 months, and we're going to check your blood sugars again. Our goal is to keep your A1C below 7. You know, So, you know, and again,
Point.
I don't want to beat a dead horse, but technology is going to help with that. Like, there's wearable stuff now. Like, suddenly people have an Apple Watch on and they're looking at an EKG, or they're monitoring their heart rate. Like, my daughter goes for a run and she's like, I got my heart rate up to like 190 beats a minute. And I'm like, so? You're a healthy 20-year-old girl. What does that data help you with, right? Like, that means nothing. But suddenly people are aware of their heart rate and they're aware of their pulse oximetry, right? And they're aware of how many steps they did.
Mm-hmm.
And that's a nice sort of baby step trend towards people starting to think about preventative care and be like, I got to get my 10,000 steps in today.
Yeah.
It's going to help me live longer. So there's a sway in society for the medical establishment to step in and take that preventative stance, but it is being the headwinds are the healthcare system is not in place to reimburse for that.
Right.
It's in place to reimburse for the gunshot, for sure.